Hello and welcome to our webinar this evening. My name's Sharon Heighton, the moderator for this evening's webinar. And this event is sponsored by Wright Milners and Clinicians Choice. You can follow other attendees and share with your own followers on Twitter, and it would be appreciated if you could use the hashtag Wright Milners. We'd really like to hear from you and would like to include your voice in the conversation. So if I could ask that you please post your comments and questions in the question bar, which is to the right of your screen, and we will then be addressing the questions at the end of the presentation. We also have Peter Alport that's joining us all the way from Canada. Peter's based at Clinicians Choice, and Peter will be joining me at the end of the webinar in answering all the questions that have been posted. At this point, I'd like to introduce you to our featured speaker, who is none other than the Dr. Mark Bowes, who needs absolutely no introduction. Familiar face and very well known throughout the country with all the webinars and courses hosted on a national basis. So without further ado, I'm going to hand over to Dr. Bowes, and we'll take it from there.
Thanks, Sharon. Thanks, Peter. Thanks, Clinicians Choice. Thanks to Milners for giving me the opportunity to, let's just have a look here. Just let me know that that's all good. You got it?
Yes, you just need to make, there we go. Perfect.
All righty. So, yes, thanks so much for that. I see in the intro, this is the first time I've been on this platform, and I see one of the requests was for me to make sure that I was smiling and that my hair was in good shape. So I hope I did a good job for that. But anyway, really, again, it's a great pleasure to spend this evening. I'm just talking, not I say just, talking about something that really is probably the core of my restorative practice down in Cape Town, which is really single shade composite restorations in aesthetic dentistry. And so, interestingly enough, we did this lecture about a year ago. So some of the slides are the same, but I can tell you that every case has changed. And what's interesting is that a year has passed, and that I have even more evidence to show you tonight how amazing single shade restorations can be in aesthetic dentistry. So when I say unbiased, the presentation tonight means that in no way would I choose materials based on any amount of money that I was being paid to use in my practice. So every material that I've selected for use and every case that I do has been selected purely on merit. And I think that's super important. And, you know, just explaining this, which is interesting, is that I've now chosen this material and I've stuck with it for a whole year. So I'm hoping that, you know, I'll be able to show you the amazing effect that it's had and the transformations that I've managed to do for what I believe are my lucky patients down in Cape Town. So I've really gone full circle in dentistry, and I think these days I love the less is more philosophy, and actually this less is more philosophy was developed by Ludwig Mies van Roda, who actually was a gentleman who understood about minimalistic architecture. He was an architect, and he decided that really we needed to simplify things and we needed to get rid of all the complex things that kind of cluttered our lives. And if we relate that, which my friend Ricardo, who was on a SADA webinar last year, Ricardo Matrini from the Spear Group, he related it into dentistry, in that really what we're trying to do as restorative dentists is to maintain tooth structure. We're definitely trying to minimize the number of teeth involved, and we'll cover that. We'll get into that a little bit deeper later. We're definitely, you know, these days trying to utilize the least invasive techniques, delay treatment if possible, phase treatment if possible for patients. For sure, maintenance is one of the most important aspects of all restorative and all aspects of dentistry. But more importantly, our patients want highly aesthetic results. We're living in that age where I think the demand for that beautiful result is at every level. So this is going to this less or more philosophy is going to filter throughout all the even complex and simple cases that we'll share with you later on this evening. So I've also been very lucky to become a Style Italiano Silver member. And I love the concept of Style Italiano because they're really also trying to simplify our work. They're trying to make our lives more simple but more predictable. And I love this saying that when the winds of change blow, some people build walls, others build windmills. And sadly, as you'll know, we had the fire in Cape Town and our very famous windmill recently burnt down. Anyway, so the three cornerstones of the Style Italiano is feasible, teachable, and repeatable. And everything that I'm going to talk about tonight, I hope, and I'm pretty sure, will be definitely feasible because I've done it. It's definitely teachable because we've taught these processes in our Style Italiano courses, and I've seen the delegates who have done our courses do some amazing cases thereafter. And so, yeah, I think that everything you see tonight will be achievable by every one of you tomorrow morning if you have this material, if you're lucky enough to have this material in your drawer. And Andy Warhol, you don't have to fear any simplification because to simplify means to make less mistakes, in all honesty, and to make it accessible to everyone, regardless of the individual skill. And I'll talk about how I've seen dentistry change completely, thank goodness, to accommodate simplification in the last 5 to 10 years. And it really makes me exciting. So when we talk about ideal composite restorations, we have to look at 4 different aspects. We have to look at the tooth form, we have to understand color, we have to understand the importance or the amount of translucency that we're trying to produce, and of course texture plays a really big part of that. The composites I think that we're using today pretty much are all of the nanohybrid type. And nanohybrids, basically, if we look back at this timeline in the 80s, we were predominantly using microfill composites. We then moved in the 90s to microhybrid. And then what nanohybrid did is it took the best of both microhybrids and microfills. And, what it did is we provided a restoration or a composite for a restoration that was both highly aesthetic and durable. So we ended up with something which was entirely durable from a strength point of view, but obviously the aesthetics is the key for any composite in the front of the mouth. But interestingly enough, which is amazing, is that these composites are also ideal for posterior applications. So, what we're trying to do is not only simplify the technique, but simplify the number of composites that we have to have in our drawer. So choosing a composite becomes so much more simple, in my opinion. If we look at a wish list, there are a bunch of things, and I thought, wow, that's a lot of things that I'd really like in a composite. But really, they're all super important. Some of them are more important than others, but I think they're all important. And if I look through, a couple of them that stand out for me, that I really think are important is the chameleon effect when blending. In other words, can we lose our restorations? Can we look at a restoration and not be able to tell that anything has been done to the tooth? I think they have to handle well. They have to have lifelike aesthetics. They have to look like natural teeth. They have to wear well. I love the new composites because they polish incredibly quickly. So again, this is a time reduction. It's reducing time. I like that they can handle well. If we go back in time, we'll remember the composites that were just stuck to everything. You couldn't actually get it onto the tooth. They have brilliant physical properties. This is the nanohybrid generation to provide strength and longevity without marginal leakage, fracture, and discoloration. And I'm happy to say that if we look at all these aspects, the composite that we're going to talk about, in my opinion, ticks all those boxes, which is amazing. So when it comes to composites, I think one of the biggest mistakes that I certainly made over the years is that, and this is what kind of made me cautious, made me maybe not go back to certain composites, that I didn't understand the composite material before I put it on the tooth. In other words, we have to understand how this is going to look before we start to bond it to the tooth structure. And again, if, one of the best ways to do it is to maybe do some trial composites on models, or come to our Style Italiano course, because we use Evanesce extensively in that course, and it gives you the opportunity to get a feeling of how it handles, how it looks, how it finishes, before we start putting it on our patients' teeth. And of course, when we talk about color recipes, we're talking about understanding the interaction of both the enamels and the dentine shades, which traditionally we used in anterior composite restorations. We would layer the restorations, and we needed to understand the interaction of the thicknesses of dentine and enamel, so that when we did that final cure and we had a look at the restoration, that it was a positive result, because we all know that once we've bonded composite to the tooth and it's not right, the only way to fix it is to cut it off and start again. And so that's something we don't really want to do. I put this slide in, and it's a slide that I use predominantly for a lecture that I'm talking about direct restorations, in other words, porcelain restorations. And actually, I thought about, the interesting thing, and in my opinion, one of the best things that ever happened to indirect restorations was the ability to get away from layering ceramic porcelain, because it was expensive, it was exclusive, and to be able to mill monolithic restorations. For me, the material that I prefer is, obviously you probably know, is Emax. But what it did is it allowed us to become more inclusive. In other words, using these milling strategies allowed us to get away from having to use an artist of a technician. And I'm not taking anything away from technicians. There's still a lot of work that goes into producing monolithic, but we were getting away from this layering concept that was time consuming and extremely difficult to master. And it applies exactly to composites, is that, for a long period of time, composites, we were expected to layer, we were expected to use dentine shades, enamel shades, tints, and stains. And this is complex. And, anything that's complex and takes time is obviously going to be more difficult for us as dentists and cost more for our patients. So getting away from layering and going into the monolithic or one shade really excited me, certainly in indirect restorations. And now we've applied pretty much the same rules. And I'm going to show you some cases later on how we utilize the same concept. So the material that we're talking about tonight is Evanesce, from Clinician's Choice. And really, if you look up the meaning of Evanesce, it's to disappear gradually, vanish, and fade away. And that's exactly what our patients want from a composite restoration. They want to be able to look at that restoration and not see anything. They would like to see exactly what they would if they had a healthy tooth. So, we've all been there. We've seen restorations where, you can clearly see where the composite is and where the tooth is. And so, this is something that obviously would have been deemed a failure. So it's a great product. I'll run through a little bit of the benefits of using Evanesce. We know that it's a nano composite. It's got a refractive index and reflective index, which is similar to enamel. We know that it has the chameleon effect, which means that we lose the margins of the restorations. In other words, the resin or the composite blends into the tooth. It's putty-like stiff, so it's easy to handle. It's sculptable, no slumps, it doesn't slump, and it's definitely, I think, one of the, if not the best material that I've used for a very long time. And as I say, I've had a year now, and I can be honest, if I wasn't happy, I would have moved away from it. So That's an honest opinion, and not saying that there aren't other composites I use, but it's my go-to composite in anterior restorative work. So it comes in universal shades, and I like the way they determine the universal shades, dentine shades, enamel shades by opacity, because it really explains exactly why a universal shade, which is 85% opaque, handles both a dentine, which is 90%, and an enamel, which is more translucent, which is 80%. So it's kind of right in the middle, and why it's possible to many times do away with combining enamel and dentine shades. Those are the colors: A1, A2, A3, A4, A5, A3.5, A4. Then we have some B shades. We have a few C shades, no D shades, and bleached. And then the UX shades are just slightly lower viscosity. And then we have dentine shades, the A shades. I'll be honest with you, if you've done my indirect lectures, you'll know that I predominantly and pretty much only work in A shades. And to date, in the last 18 months that I've been using the product, I've only used A shades and bleach shades. That's it. I do use the dentine shades, again, only A shades, and the enamel shades, only A shades. So, and then the enamel incisal white and clear, those are the effects, which, again, for me, the one that I use predominantly is enamel white. So those are the different shade options that we have. I think, that, again, if we're doing adhesive dentistry, and here I'll talk for indirect and direct restorations, then, the way that we clean surfaces and, we're bonding, we're gluing, it's absolutely vital that we're bonding to clean surfaces. And so the way that we do it in our practice, that absolutely every surface gets cleaned with aluminium oxide, 29 micron aluminium oxide in an aquacare. Those are the other options. 53 microns allows you to cut. Sodium bicarbonate for cleaning. And silk is amazing. It's quite expensive, but it's also for desensitizing, cleaning, and polishing. So it's really a nice combination of the 29 and the sodium bicarb. Isolation, again, that's that's something that it's just something you need to do. And once you've introduced rubber dam into your practice, you feel uncomfortable doing any adhesive technique or any adhesive protocol without it. And it's really one of the things that our patients like. It makes working easier. And I really believe from a clinical aspect, it gives us a better result because of the moisture control and just the ease to work, that we become faster with rubber dam. There's no question. So we have options of full dam, split dam, and Optrogate. But I think that from all the cases, you'll see that full dam is for me the go-to. And I've changed over. And again, this is not, it's not a product-driven lecture. I'm honestly giving you my interpretation of the products that I'm using at Enamel. And I've changed over to the True Dam. It comes in a latex and a non-latex. It's a medium thickness. And I absolutely love it. It really works well for me. So, right. So if we go on now, that I've already given a little bit away, if we're talking about single shade versus layered, where we want to be practicing if possible. So for sure, when it comes to indirect and direct, there is a time and a place where we need layered restorations. There is no question. And really, we're looking at mostly young patients because of the translucency, because of the opalescence, because of the mamelons, because of what we see in the restoration and what we're trying to replicate. And again, if we're doing large class 4s, class 3s, and our align, bleach, and bond cases, but predominantly in the young patients, and I'll show you. Single shades, where do we look to use single shades? Wherever possible. So my first choice is when I'm doing anterior restorative resin work, will be, is it possible for me to do this with a single shade composite? And I have to convince myself that I can't do it before I start to look at whether it's a layered option. We talked a little bit at the beginning about direct restorations, and really the three aspects that we need to have a good understanding is the shape that we're trying to achieve, the texture of the restoration, and the color. And actually I've put them pretty much in the order that their importance, and color comes at the bottom, surprising for most people, because I think most of us spent most of our lives thinking color was the most important, and then didn't pay attention to the two most important, which is shape and then texture. Of course, you know, if you're going to do that beautiful restoration, you're going to nail all three. But luckily, color becomes for me the easiest one, to be honest. But shape is the one that you really need to focus on. And so if you really want to look at the tooth from a color perspective, and to look at a tooth to decide, is this tooth a layered or is this a single shade, then there's no better tool than polarized photography and the polarized filter. So if we look at this, what it does is it eliminates the glare, and it allows us to look into the tooth. So it takes away any of the glare that we get from the filter, from the light. And as you can see on the right, we can see right into the tooth and see what's going on. And so here's some cases that I did. These were quite big class 4 restorations. And I want to show you what happened is that in this one, we got the color and texture amazing, but the shape was wrong. And so when I look at it, you know, it disturbs me. I think it's a pretty good result, but the shape was incorrect. If you look at the distal line angle here, you'll see this is bulged, and here we just went straight, and that was quite disappointing. And I think that if we'd got that right, yeah, that would have really been an amazing restoration. Another class 4, and if we look at the difference on these, you'll see that here we got color, texture, and shape right. So what I'm urging you to do when you go to, and we'll talk a little bit about finishing, is to look at the shape of the tooth and make sure you understand that. Just going to look at 2 papers. One was written by Didier Dici. Sorry, I'm just going to go back there. It was a literature review over a number of years. I think it started in the late 70s and finished in 2010 or 2015. But really a long review, so it was difficult because materials changed, bonding protocols changed, all sorts of things changed. But the things that came to light in this paper was one of the major complications was basically degradation of the margins. And again, you know, I look at that and I think that's where the aquacare and sandblasting is super important. Mismatch was really not a color mismatch, and marginal discoloration was a minor complication, but I'm not so sure that's the case. I think that we were more forgiving than we are now in 2021 as to what's successful and what's a failure. And the interesting thing about conclusion was that the operator and the environment have really a large effect on longevity. So, you know, we have to look long and hard at what we're doing, isolation, sandblasting, and all these aspects as to whether these restorations are going to be long-lasting. Another paper that was really interesting was it was a direct composite restorations in the worn mandibular. They looked at a 7-year follow-up. It was a prospective randomized controlled split mouth clinical trial. What they did is that they found that they found that restorations that took more than 11 minutes had a higher likelihood to fail than the restorations that were done inside of 11 minutes. So what that's telling me again is that really in those cases where maybe things were simplified, that the results were actually better. So this is something that really excited me. So if we look at some shades quickly, and you look at these teeth, just to give you an idea, you know, whether you think that we can replicate this sort of incisal edge where we've got halos, we've got orange opalescence, highly translucent. So this sort of incisal edge, definitely, if we're doing a single tooth, definitely, and again, if you look at it in the polarized light, definitely needs a layered approach. And again, if you look at these sorts of teeth, there's no way, if you're doing a single class 4 on one of those centrals, that you're going to be able to achieve that kind of replication of that kind of color with a single shade. So, there you're going to have to rely on layering techniques with tints and stains. Whereas here we replaced the central incisors, the incisal edges were worn, and funnily enough, the 2 central incisors below needed replacement. They were old crowns. And because we're determining the incisal edge of both of those centrals, I'm going to opt for a single shade because I don't need that complex opalescence, translucent halo effect. And you can see with the single shade composite and monolithic ceramic at the bottom, how beautifully these restorations can blend in to the smile. So finishing is important. I want to get to the cases, that's more important. But we have to really understand the anatomical features that we're trying to achieve before we start finishing and polishing a restoration. So we have to look at it. We have to have a clear understanding of what we're trying to achieve before we pick up the discs, before we pick up the burrs, before we start creating the final restoration. And again, we know that color and shape, of which shape is the most important. And when we're thinking shape, which, as you know now, is more important than color, we have to think 3 dimensions, because most of the time when we finish teeth, we look at it from the facial surface, and in our mind, all we're seeing is the 2 dimensions. But we have to constantly think about the 3-dimensional shape that we're trying to achieve while we're going through our finishing protocols. So for me, these are the tools that I use. It's a 12A scalpel blade, a red flame diamond. I'll show you the actual diamond from Horico. The polishing discs, contour polishing discs from Clinician's Choice. I generally use the medium and the coarse, that's it. And then I do like metal strips from Horico. I finish off with the GC strips, the Epitex strips, and the A.S.A.P polishing discs, which we'll speak a little bit later. That's the final part of the finishing protocol. So when we think about shape, there's 2 parts to it. The first is an additive technique. In other words, we're first adding composite to the restoration, and we're trying to add it in such a way that we're reducing the finishing protocol. So we're making sure that when we place the composite, we're providing the closest final replica of the tooth that we're going to achieve. And of course, then we will sit down with the subtractive technique and reduce the restoration until we have the ideal result. So the additive, what I mean by additive is we'll always use, certainly in class 4, we'll use a palatal shell to determine the outline of the tooth and to determine the palatal aspect of the tooth, or otherwise the occlusion. So these are 2 surfaces now that I've not had to finish. It's been done from a wax up and then transferred through the shell. And then the subtractive technique essentially covers the buccal surface and interproximal areas of the class 4 or the aesthetic restoration, be it a class 4 or a veneer. And again, here we're going to divide it into transition lines. So this is where the buccal surface turns into the interproximal area. We're going to look at the macro texture, which is the grooves that we get from the lobes of the tooth. And then, of course, the micro texture, which we're going to get from the pericomata and the surface of the tooth, depending on what's happened to it over the years. So you'll see that in the middle there, I've drawn 3 lines, because when we're finishing the facial surface, when you're looking at it from the front, you lose the 3-dimensional aspect that we have to take into account. And those 3 lines divide the tooth into 3 areas. So if we get to that, let me just get to the next slide. So this is the flame burr from Horico that we use on a red handpiece, on a red ring handpiece, electric motor and without water. It's pretty much that's going to do about 80% of the finishing of the facial surface of the tooth. As you can see, we've marked the transition lines, we've marked the grooves, and then using red articulation paper, very thin, we can then determine that we have copied exactly the anatomy that we're trying to achieve in that restoration. So we talk about biotype, which is the outline of the tooth. We talk about the outline of the tooth. In other words, the shape of the tooth. Is it triangular? Is it rectangular? We talk about the transition lines. That's where we're going from the facial surface to the interproximal, macro and micro texture. And again, what I was helping you is to think about the thirds. So we divide the tooth up, and it's pretty much like when you're doing a preparation for an anterior tooth, that we have to move the burr in these three planes. So we can break it up into the gingival third, the middle third, and the incisal third, and that we have to really keep the burr in that plane. And this is why it's impossible to use a disc to follow the contour and finish the facial surface, and that's why we use that flame-shaped red diamond to help. So think 3D from now on. When you're finishing, think about all those aspects and all the anatomy, the macro and the micro and the transition lines that you're trying to replicate of the natural tooth. The A.S.A.P Dailies, these are the Dailies. These are a new addition to the A.S.A.P burrs, which we use all the time. And these, I think Peter will talk a little bit about, have been added because they're quick and easy. We can also autoclave them, and that they're designed to really be disposable after I think 3 or 4 uses. But the A.S.A.P concept of just having 2 polishing protocols is really changed it for us. You know, we used to go through a whole host of different methods of trying to achieve just that beautiful finish that we get. So let's get into the clinical cases, and I'll sort of slow down and talk a little bit more about what went on and how we managed each of these types of cases that we get. And I think that's pretty much the entire aesthetic issues that we get: class 3, class 4, light dentistry, and we'll talk a little bit about what that concept is, tooth wear, veneers, aesthetic cases. I know that's a little bit ambiguous, but I'll get into that, and canines, which is really something that has changed a lot for me, my indirect cases that I was doing, especially veneer cases. So class 4, I think this is pretty much the bread and butter, again, of aesthetic anterior work. And there was a period of time for many, many years where I considered that every class 4 restoration, if you wanted it to be highly aesthetic, had to be layered. And that's mainly because the universal composites that we had access to all look gray, to be honest. And I think we remember those days that we would try use a single shade and we'd cure it, and the restoration would be gray. And you'd see completely where the restoration was and where the tooth was, and it was really disappointing. But with these new composites like Evanesce, Universal, this is certainly not the case. So the process is to determine the shade, like we did looking at the teeth with polarized light. This is, in all honesty, the easiest way to determine that you have the right value of composite. I only use A, so it's really easy for me. I have to then decide, is it A1, A2, A3, or bleached 4, or bleached 3. Here we're using an optic dam from Ivoclar. I have to say I'm not really fond of these. I was given it. I just find the access is impossible. But what's the protocol is to remove the old restoration, polish it smooth. Don't leave it rough. You'll see there's a long bevel here. Practically this whole surface has been beveled. And then the aquacare, so that surface is clean. No sharp edges on the edge here when we're bonding. And that's really the most simple way. Single shade, here we used a palatal shell, quick and easy. We've got, you see the outline, we've got the palatal aspect already taken care of. I just need to finalize the shape of this tooth with the transition lines and any micro and macro anatomy that may be visible from the 1-1. And very quickly that's possible to achieve that sort of result, which really, in all honesty, not that long ago was impossible with a single shade. And now you see what we're talking about, the chameleon effect, that we lose the color of the restoration into the tooth, and it's almost impossible to see where we transition from composite to natural tooth structure. And again, why I think this case was a success was really because of the shape, in all honesty, that we got the shape right. And that's why it looks so good, even if I might say. Right, so let's look at a really challenging case. We're looking at class 4, class 3, and veneer, single shade. So here was the pre-op situation. And yeah, when you look at this sort of case, you're kind of thinking that really what you need here is probably 2 ceramic restorations, maybe layered ceramic restorations. There's a small class 3 on the 1-1. Which I think we'd all agree we can deal with composite. But even those composites, not that long ago, needed to be layered, where we had a dentine and an enamel on top of it. Otherwise, we would get this gray area around here. And that was really, again, quite disappointing. But I can honestly say this case was done. I'm not going to break it down. I'm going to show you just the end result. This was done, 1 appointment, 1 shade of composite. That was it. I used A1 universal. And why do I think we got a good result? Well, because we got the outline right. We've got the micro texture right. We've got the macro texture right. And yeah, I think the shape is really of these restorations, the shape of the lateral, the central, and have a look at the class 3 restoration on the 1-1. So, yeah, I mean, cases like this just astound me, when I look back at them and I look at what I've achieved with a single shade composite, no layering, a simple method, a simple approach. But in all honesty, what's the most important thing is the outcome. And yeah, this will never, I will never go back. I mean, there are a few cases, but I will never go back to the layering of composite that I did for many, many years. And that was the end result. Very happy. Yeah, that's like a 2-hour case for me because we're not layering. And the important thing, I think, about not layering, which we need to mention, is that, if this patient had an accident and broke one of those restorations, if we had layered it, it would have been complex to go back and either repair it, because we would have had to have known the recipe of the dentine shades, the amount of dentine, the amount of enamel that we used to replicate the repair, that it matched exactly the original restoration. Whereas if we're using 1 shade, suddenly a repair becomes the easiest thing to take into account. So I think that's also something that's seriously important that we have to consider. So let's look at wear. Wear for sure in 2021, I don't know about all you guys and girls who are watching this webinar, but wear is right up there as to one of the most common reasons I end up fixing teeth in the front and the back of the mouth, but certainly in the front of the mouth. And these are cases that come in all the time, relatively young patients looking for an aesthetic results. So in this case, it's a light dentistry case. And what do we mean by light dentistry? Light dentistry really is a concept of using simple alignment of teeth. In other words, to create maybe space or to create a better aesthetic outcome. So here we used aligners to create an overjet because it was a wear on the palatal surface. We use bleaching protocols. My favorite bleach is White Dental Beauty, and then restorative protocols of bonding, adhesive dentistry, composite dentistry. So that's the light approach. And again, we know this really makes a huge part of what we do in our practice these days. So in 8 weeks, we aligned the teeth. We then had the teeth aligned, but obviously, and I tell the patients that after we've aligned them, they're going to look terrible. And it's only when we get to the bleaching and more so the bonding, the resin bonding, that we're going to transform the aesthetics. So, there's no lecture for me without the DSD, and for sure, each case we do is driven by DSD because we're going to do a wax up. And then we were going to create the palatal shells, which were going to give us the new occlusion, simplifying the protocol of bonding the restorations, and also create the ideal aesthetic incisal edge position for the patient. So no difference, polarized light, looking at different options of translucency, of opacity, and the value of the composites. Here we chose a single shade. Middle picture, top, aquacare, cleaning, palatal shells that were determined from the wax up, which was determined from our DSD. We built up the interproximal areas. The next slide, we placed the rest of the restoration. Normally we would be building up dentine and then on top of that the enamel, but this was all single shade. We're outlining the transition lines. We've already got more or less the outline of the tooth, in other words, the incisal edge, and now we just have to finish the facial surface. So pretty much that's all I need to do. Transition lines, macro and micro texture, and then polish with the A.S.A.P polishes, and we're out of there. So here we chose A1 universal. I have to say most of my cases are A1 universal. So if there's a shortage of A1 universal in the country, you can blame me. But that was the final result, single composite. And no grayness, no transition, chameleon effect to the max, beautiful outcome, natural outcome, and pretty happy patient at that. Simple dentistry, non-invasive, non-expensive relative to obviously ceramic, and I must say that my number of indirect cases has dropped dramatically since I've understood the skill and the ability to place single shade composite restorations. No question. So if we look at another case of light dentistry, here's a patient that came in again, slightly older, but again, for the age of the patient, excessive amounts of wear. You can see that there's been some attempt on the 2-1 of some old restorations that have failed. You can actually, if you look at it carefully, you can see the grayness that would have been there. But anyway, the patient understood that she needed some alignment first. You can see the lower teeth, the upper teeth, it's not clear, but she, I think, had about 6 aligners at the top, something like 12 or 13 at the bottom. Once that was done, we went through a whitening procedure. So here you can see we've aligned the teeth, we've whitened the teeth. So we used clear smile aligners and white dental beauty. And now we're ready to do the bonding. So actually there's not been a lot of aesthetic improvement, but once we start the bonding process, this is where it comes. So rubber dam, as you can see, full dam, most of the cases that we're doing. Here all we've done is removed the old resin fillings, and I see actually I probably should have smoothed that mesial edge on the 2-1. I've cleaned it with the aquacare, and now we're ready to apply our etch and bond, universal bond, and we're ready to apply single shade composites. So we placed the palatal shell, and in all honesty, every case is just the same. We placed the palatal shells. The palatal shells were determined again by the DSD, by a wax up. Can be, I think in this case, we did a digital wax up. So we printed a model and made the shells. And then those of you who have done the Style Italiano course, and those of you who haven't, please come and join us. But these matrices have really changed a lot in these more complicated build-ups that I do now. And again, without them, I think that is without them, definitely, without the composite and without these sorts of matrices, is the reason that I convince patients to spend more money on porcelain restorations. But now with the help of these materials and matrices, I really choose composite more and more. I'm not saying that there are not cases that need ceramic, but more and more I'm happy that I can achieve the desired result for the patient, non-invasive, really simplified dentistry. So these are the Unica matrices from Polydenture. And you'll see that what they do is they give a beautiful rounded curve to the profile of the tooth, because with the straight matrices, you get that straight line. And if you remember the first case that I showed you of that class 4 where I got that straight distal line angle, that was the reason that we used a straight matrix for that. So from that, we create the outlines. We build it up all single shade. And all I need to do now is fill into the internal here with, again, the single shade composite, trying to follow the three-dimensional anatomy of the tooth that I'm trying to replicate. So again, we mark out the transition lines. We mark out the macro texture where we're going to put in these macro grooves. And then we start reducing with the red handpiece, with an electric handpiece, with a red diamond without water. Pretty quick, pretty easy, and total control. That's the difference between fast handpieces. In my opinion, you can't use a fast handpiece because you have zero control in these situations. So that's after about probably 10 or 15 minutes of shaping. We're ready to sort of move on to the final polishing process. And that was using BL3 universal. I haven't seen this patient, but, again, for what's the most important for me on a case like this, this was directly after the rubber dam came off. I have to say that I always see my patients about 2 or 3 weeks after. This patient hasn't come back yet to see me for a final polish. But, I think that all that will happen in this case will be that the gum looks a little bit healthier, and I'll need to do very little shaping and polishing. But ultimately here, it's the beautiful aesthetic effect of the color of the composite, but more importantly, I think that the outlines that I've achieved for this patient is what's really made the case pleasing. So canines are really, again, something that's allowed me to be more conservative, to treat less teeth, when I look at these aesthetic cases. And it's a time where I'm starting to mix more porcelain with resin, because wherever I can use resin, it means I've saved tooth structure and I've saved the patient from a financial burden of an indirect restoration. And we, for sure, we need to understand, and I think for all of us who are on social media, that more and more I see cases that really have had porcelain veneers, on 12 teeth, on 20 teeth, that could have been treated in a much more simple way. And so I've been there, and I've seen it done, where really the solution, certainly on some social media platforms, is 10 or 12 veneers. So here's an interesting case that came, and he had quite a lot of old composite work done on his front 4 teeth, but the rest of his teeth were in good shape. So we did a DSD. That was the starting point to see exactly what was in the wrong place, what needed to be fixed. And in fact, he asked, I think this patient asked for 10 veneers. He wanted me to do 10 veneers. We ended up deciding on 4 veneers for him. And I think you'll agree. I don't know if you'll, certainly at the end we can talk about it, but we feel whether it was a success, or maybe 4 more veneers or 8 more veneers would have been something that would have enhanced the outcome. Let's talk about that. But anyway, that was the situation. We removed the composite. We did a mock-up, and what we can see is that if we're going to do, and there are a number of these cases, if we're going to do only 4 teeth, you'll see that we're going to end up with a transition from the ceramic to a pointed canine, which is unpleasing. And so somehow we have to transition our restorative work into the natural dentition. And that's where not doing a veneer on the canine is the answer, but allowing us to transition the indirect restorations onto the natural teeth. And again, why don't I don't want to put veneers on the canines, because if you put veneers on canines, you either have to prep all the way through the enamel. We know that if we start to place veneers in dentine and margins in dentine, that the failure is going to go up 10 times or more. And that if you put a veneer and you go in an additive way, suddenly you're going to have now the premolar is a problem. So you're going to lose buccal corridor. And I've seen so many cases where you see these 6 teeth that have been built out and you can hardly see the premolars behind. So I think for me, and don't forget that the enamel often on the canine is at its thinnest because of what's been going on with toothbrushing. So once you start prepping the canine, it's often that you get 0.3, 0.4 into the tooth structure, and you're already into the dentine. So be careful when you plan to do 6 veneers, in my opinion. It's one of the most challenging aesthetic cases, in all honesty. And you can see already these canines are buccally placed, and so to make them more buccal with ceramic would be really, I think, a disaster. So we did a mock-up, and what we did is we obviously closed spaces. We got better tooth proportion on the 4 incisors, but what you can see is that we've transitioned on the mock-up with the canine so that things now blend a little bit better. From a restorative point of view, there's now a simple process, guided tooth preparation, nothing's changed. We use indexes to control everything. And again, you can see the transition when the veneers came back. So these are monolithic. You can see the transition problems we would have had with a sharp pointy canine and a beautiful shaped lateral at the big embrasure. So that's where we're going to, we're going to now use a single shade to build up the canine. So here we're looking at bleached 3 universal. And what I'm doing is I'm looking at it on the tooth to see that it blends to the tooth. And I've also got a blob on the veneer to check that it's the right shade for the ceramic. And you can see that BL3 universal blends beautifully with both the ceramic and the tooth. And that was what we chose. So that was the initial situation, 4 veneers and some bonding on the canines. And I think that, as I say, if I definitely tried to include those canines with ceramic, it would have been a disaster. And we would then have had to go to the premolars. And I think that from my aspect, I'm pretty happy. The patient was pretty happy. Again, single shade ceramic, so monolithic Emax restorations, monolithic Evanesce composite BL3 universal. And you can see, if you look at the difference between the ceramic and the resin and the tooth, it's really hard to see the difference anymore. And so this is really, I think, where we're so lucky as dentists working these days. Here's another case. I think I finished this case today. The patient came in for a single non-vital crown needing replacement, and we ended up doing 3 veneers and a similar composite situation. I won't go through it quickly. That was a try-in, and you get to see exactly what I mean, that if you stick to 4 veneers, again, this is a failure for me from an aesthetic point of view. But now having the ability to take a single shade composite and get this transition from ceramic to natural teeth, is the beauty of these materials that we have access to. That again was a BL3 universal ceramic restorations, and how they blend together, because obviously they're all monolithic single shade, and we've definitely simplified these things. So just a couple more cases that are quite interesting, and then these will probably take 5 minutes, and then we'll be done. Even getting more complicated kind of combination type treatments with indirect, in this case, we had a big class 4 on the 1-1. We had a non-vital tooth on the 2-1 with an old crown and a little bit of alignment issues on the lateral. So in this case, we decided to align the lateral. I think it took 4 aligners. We did some laser recontouring on the soft tissue. So it's really simplifying treatment We replaced the crown, which we had to, with a single shade, a monolithic Emax restoration, and we removed the big class 4 and replaced that with a single shade Evanesce composite. So those are the problems that we highlighted, and really breaking it down now to become, in my opinion, a fairly simple case, because again, we're not expecting complex layering that went on obviously when this crown did. We're just milling it from a design, and we're going to use the single shade. So here we decided, and in all honesty, I probably prefer to do it the other way around, but in this case, I wanted to see how it would work out, that we did the restoration before the crown. Normally, I would do the crown and then do the restoration so that I have the ability to change something small if need be, whereas here I'm relying on the technician. And by the way, Shane is amazing. I think he might be watching tonight at helping me. We work together. So what you see is a long bevel. That's the bevel. Smoothed everywhere, smoothed, polished, and then sandblasted. That's the treatment, the pre-bonding treatment of the tooth. That's the protocol that we use every time. And again, a closer look. So long bevel, AquaCare. That was the situation when we removed the crown. I was a little bit horrified. Here you can see the class 4 is done. That was the shape that I wanted Shane to copy now. So we're going to go ahead. We're going to try and mask that a tiny little bit. We would have used some opaque composite on the core. And there we combined LTA1 Emax with A1 Universal Evanesce. And, I think when I keep seeing results like this, and I keep understanding that I'm simplifying my work all the time, but actually enhancing the outcomes, it makes me want to be a dentist for a lot longer, to be honest with you, because these sort of results 10 years ago were, in all honesty, not possible. And that was the final outcome of that patient. Simplify, simplify, simplify. I think we have one last case. We're going to do it the other way around this time. Here, a patient came with, again, a wear. So we're managing color, we're managing shape. She obviously wanted more than just replacing the crown. She had worn down her teeth. And so, here we're going to have to understand the color issue and the shape issue. So in this case, we did the crown first. So we opaqued the stump to help Shane with the blocking out that discolored root. We looked at, this was on Communicate, just to check everything was the right shape, because he was now determining the shape of the final restoration. So whereas previously I was determining the shape by doing the composite first, now Shane was determining the shape by doing the indirect porcelain first. So I wanted to be sure that the outline of the tooth was exactly how I saw the outline of all my composite my resin restorations. So the communication is really key in these cases. So we did a try-in, and what you see here is I'm trying the restoration in. At this stage, I haven't done some composite, but I've just taken the composite that I think I'm going to use, and I'm putting it on the tooth. It's not bonded, and with polarizing light, I can see whether or not there were some problems. And here there was basically just too much stain. I asked Shane to remove it a little bit so that we could get this. But if you look from the middle of the tooth to the incisal edge, it was amazing that the color match was perfect. So all we needed then to do was control the shape. Here we went back through the dilemma of making two crowns. One was digital, one was handmade. And, in all honesty, this was just a waste of time, because you can see that to achieve this with staining and glazing versus layering, and I'm not saying staining and glazing is easy. I think you need a skilled technician to be able to achieve these sorts of results. But, the problem that I often see is that the technicians now put in a lot of translucency, opalescence, and then they leave us with the problem of having to replicate that with our restoration. So we try to merge the two, that we always have the same situation. And it's much easier to manage. So those were the two crowns. We chose the digital. This was digital. This was layered. We chose the digital version. You can see that he's taken some of the stain off. I'm now about to do the resin restoration. So what am I doing is I've taken a polarized, I'm confirming. We're using the universal shade, and you can see that it matches absolutely beautifully. The last thing is for me to make sure that the shade is ideal compared to the Emax restoration on the 21. So no difference now. We used a diagnostic wax up or a digital printed model to give me the outline of the tooth. We used the Unica matrices on, I think, all 4 anterior teeth. And then again, the technique of just blending the canines so that they filter the indirect, direct restorations into the rest of the natural dentition. Outlines, we go through the same finishing protocols. Here again, we used LTA1. So once you've done a number of cases, we know that if I'm going to attempt to use A1 universal, then Shane will go to LTA1 as an Emax choice for the ingot for us to get the exact match. So now we've done this a number of times. It's pretty simple for us to do. And I've saved that person 5 indirect restorations. That's a lot of money, in my opinion. So that was the beginning, and that was the end. And I think that, I've been able to now take ceramic and work in the mouth with resin and get these sorts of results has really been, and this is only in the last few years, has been something that's allowed me to work, definitely in a less invasive way. And to be more kind to my patients' teeth and their pockets, but not to compromise on aesthetics. For me, that if I'm compromising on aesthetics, then we have to really rethink the process. So that was the final result. I think a patient was super happy. I'm going to whiz through this one case. So again, this is a case that I did almost no dentistry for, but please focus on the smile. DSD. We did the least amount of dentistry. I almost did nothing. I almost thought that there's no way this can make a difference. And so all I did for her was single shade. I changed the incisal edge shape of the centrals, and I recontoured the laterals. That's it. Nothing else. I think this took about, so you'll see that we changed the incisal edge of the centrals, and we just recontoured the laterals. She had round centrals and square laterals, and I wanted to give her the same tooth shape on the laterals and the centrals. It couldn't have been more simple, but it couldn't have had a more profound effect on the aesthetic outcome. Rubber dam. Those are the restorations. That was at the time. Tooth needs to still rehydrate. I think 3D finishing before and after, and the difference that made was just amazing. So, starting with the less is more approach and finishing with the less is more approach. Now I'm going to end it there. The purpose of this really was, rather than to teach a lot of protocols of how I placed the composites, was really to show you how for over a year I've been using these materials, which I feel has really been the core of success on all these aesthetic cases that I've done. So I think that the smile curve, less is more. So those of you who know, those are the courses. I'm happy to say we're back to running our courses. IAS Academy aligner treatments. Top right, John and I do the composite restorations. That course really excites me because it's really just about all of what we do in our practices. The advanced restorative course we're doing in about 6 weeks. Unfortunately, it's sold out. We are doing another one later in the year. And then, of course, the smile design courses that I've been running for many, many years now. So there we go. If you want to, you can always follow me. But anyway, question time. Thank you so much for everyone. I hope you stayed awake, and I hope that there was something of value for you there.
Mark, thanks very much. So So
That's
we do
okay.
have
My
some
pleasure.
questions.
Okay, let me just stop. Yeah.
Do you want to close your presentation
There we
there?
go.
There
All
we
good.
go. Okay.
Yeah.
So the first question we have posted is from Dr. Cavalleratos, and he'd
Yeah.
like to know any tips for getting rid or controlling the aluminium oxide powder.
Aquacare. No, I mean, I think the beauty of Aquacare is that obviously, first of all, it's not just powder; it's powder and water. So, you know, if you just use powder, it goes everywhere. You know, I mean, I've taken films of my photographs of my patients afterwards, when I didn't have an Aquacare, and it's like they changed their hair color because there was like aluminium oxide everywhere. And the problem with aluminium oxide is it's so fine that it gets into everything. It gets into your cameras, it gets into your computers. And so the beauty of Aquacare is it's combined in water. That's the first thing. So the powder doesn't just go everywhere. And then after we've finished the sandblasting, copious amounts of water and high volume suction. And the rubber dam is, you know, because it's all now focused in one area. So if you use Aquacare and a rubber dam, you know, you're going to control that really easy.
Okay. Our next question is from Dr. Sedat. He wants to know, are you warming this composite before placement? And if yes, how are you warming it?
Okay, so yeah, I mean, there was a time where it was fashionable, and I still use composite heaters, but not for working with these sorts of restorations. And I think that you know, the reason we warmed composite, if I think about it critically, is because they handle so badly, you know. But now the composites handle so beautiful. They don't stick to anything. They're the right viscosity. You put them where you want them, and they stay there. So I think there's no. I've found zero need to heat these composites, to be honest with you.
Okie dokes. The next question is from Dr. Velgemut. He would like to know, which shades do you use most?
Pretty much A1, Bleach 3, the BL3 Universal, A1 Universal, and A2 Universal. That's, I mean, really, I you know, every now and then you're going to have to go to an A3. And then I also use some of the enamels, the incisal, the enamel shades. So I use the translucents. So often if I'm using a universal shade, and I feel I really would like just a little bit more translucency, I still don't switch to dentine enamel. I stay with the universal shade, but just allow a little bit of space for the translucent enamel shades. And I like the white, but there's the two others that are options. You know, I try and simplify the process as much as possible. I break it down and I look at what is the most simple way of achieving a perfect restoration, you know.
Okay. Dr. Velgemut would also like to know, do you use the same material for the outline, or do you use a flowable material?
Okay, so no, I don't use the flowable. I use the same material through the whole restoration. Yeah, so it's for the outline, for the palatal shell, for everything. So the whole lot. I'm not changing. I personally don't want to have different materials. If I've decided to go single shade, I really want it to be a single shade restoration.
Okay.
Yeah.
And then Dr. Aberdeen would like to know, what is the thickness of the Unica matrix, and how do you ensure good contact while using 2-in-1 contact area?
Yeah, so what you can do, that's not a problem, is that you can put both matrices in, like you, I think you saw on one of the slides. So what I would do is, you see that we have a wedge, first of all. And second, what I will do is I will only pack, although both matrices are in, I will pack one tooth and cure it, yeah? And then pack the other one against it, rather than having both of them against each other and packing and then curing together. So you can have both matrices, and then after that you can actually, once you've created the outline of the one tooth, you can even remove that matrix if you want. but they're super thin. And if it's wedged apart, you have no problem with contacts.
Okay. Dr. Cavalleratos commented back on your answer. He says AquaCare also goes everywhere.
Yeah, but not so bad. I agree. I agree, but you know, that's the price we have to pay for a clean surface. I still wouldn't consider bonding without cleaning the surface with some sort of air abrasion. You know, I'm not here to make, I don't get paid by AquaCare either, by the way. But, you know, that for me is definitely the best. Also because I can have two powders in one machine.
Okay.
So I can have silk and 23, or I can go up to 56, and yeah, I can choose which powders without having to change. So it's super convenient.
Right, we've got a question here from Dr. Ramathlodi. You'd like to know, for severe fluorosis, which shade do you recommend and how would you approach it?
Yeah, so severe fluorosis is a difficult one because of obviously the bonding problems that we're going to get. So that's my first concern, because obviously, you know, we don't have the same calcium content in the enamel. So bonding is going to be slightly compromised. And actually, in cases like this, often I will spend a month or two with the patient with trays, trying to recalcify the enamel. So using tooth mousse or something like one of these products. And then, you know, you're going to have to use a much more opaque material to get rid of, or to have enough space to mask the white areas. And you know, here's a case, this is a situation where I might decide to even prep the tooth a small bit just to give me a little bit of space for material. You know, and the beauty about composite versus porcelain is that it's very simple to see the outcome before you start. You know, whereas with porcelain, you have to mill the restoration, and then it gets sent to you and you put it on, and then you realize there's a problem. With composite, you take the shade that you anticipate to be the best match, you put it on, you cure it, not bonded, and you evaluate it in the right thickness. And if it's good, you pop that off, and then you go through the bonding protocol. So, you know, this is a big difference, a big help for us as restorative dentists, to evaluate the end result before you start from an aesthetic point of view, from a color control point of view. So yeah, you might find that you're going to need to use even a dentine shade on the body of the tooth and combine it without even an enamel. So that's a possibility. But as I say, all you do is you really try it, and if you need more space, you might have to prep the tooth a little bit.
Okay. And our last question for this evening is again from Dr. Cavalleratos. He'd like to know, how do you decide whether to use injection molding or nano-filled composites?
Yeah, that's a good question, actually, because, you know, now that materials are being developed for injection molding, yeah, that's given us even another option. And so for me, I prefer to go down the injection molding if it's a severe wear case and I'm having to build up three-dimensionally the occlusion. So in other words, if we're opening vertical dimension, if we're wanting to change the guidance patterns of the patient, because by using injection molding versus direct composite in the mouth, we have the ability to design the shapes of the teeth. And I'm not talking about the optical shape of the tooth. I'm talking about the functional shape of the tooth. In other words, the occlusal aspect of the case. We get to design it on the computer, on an articulator, and then transfer that directly into the mouth, but very accurately. So it gives more control on the functional aspects from an injection molding, but maybe slightly less control on the aesthetic outcome. So the balance is, you know, on these cases, we saw there was less changing of occlusal surfaces and more changing of aesthetic surfaces. So if that's the case, I would go with a nanofill, doing it, you know, in the mouth versus If a case needed opening of vertical dimension, changing of guidance, I would do it controlled, and I would just take that information and transfer it with injection molding.
Perfect.
That's right.
You know, Dr. Mark, when we first started discussions on hosting this webinar, you elaborated on the fact that, you know, direct restorations are the new treatment of choice due to their minimally invasive approach and the economic benefits to your patients. And I think from what we've seen from your presentation tonight, I can confidently say that Evanesce Universal, you know, falls within that magic bit of your presentation, which is the magic of single-shaded composites and aesthetic dentistry. So thank you very much. I'd like to invite Peter onto the stage. Well, you're on the stage, Peter. But just to elaborate on the fantastic offer that Clinicians' Choice has on offer for our delegates this evening. And then also just to touch on the hands-on live learning session that's coming up on the 10th of June.
Yeah, thank you, Sharon. Appreciate that. So first of all, we apologize for not getting the composite to you as quickly as we would like. Unfortunately, due to COVID, and I don't like to make excuses, but due to COVID, we've had an issue with raw material supply, and so we will have composite in South Africa by the 3rd week of May. But in lieu of this, if anybody that is willing to try the composite and place an order with the right Milner Group, what we will be doing is providing, with every order placed, is a promo pack of the A.S.A.P polishes, as well as a promo pack of the contours, finishing and polishing discs. Comes with a little manual. The discs are in 1/2 and 5/8 inch sizes. And that is a 548 Rand value that we would give to you at no charge. And then I really encourage people to take advantage of our Hands Online Live event that we have planned for June 10th. This is a concept we started in North America about 2 years ago. We believe it's the future of continuing education. But, you know, especially in light of what's happened with COVID, you know, and people not being able to attend live events, what this program does, it's not a materials thing, it's really teaching technique. But what it does, it gives you the ability from the comfort of your own operatory to log in and follow step by step how to do these different techniques. And the beauty is the kit that you receive, which includes the model, the instruments, all the materials you will require for that course, you get to keep that. You don't return it. And so we've been running these programs for about 2 years now in North America. We have about 9 different programs currently, and we're adding to our offering has grown significantly. We've had over 2,000 dentists here in North America take these courses, and we find typically after a person has done one of these courses, they're signing up for the other courses because they see the benefit of this step-by-step tuition, if you will, and not just you know, you can attend a program and you can see before and afters, but this really, what they do is they'll do a short presentation and then they'll do a step, and then they'll give you the opportunity to do a step. And what happens is there's a video that plays continuously. So we all know that people work at different speeds, but basically it gives you the ability just to see how that step was done. And then there's a little feature where you just put a little thumbs up, and then we know that everybody's completed that step, and then they move forward to the next step. So I know that the course it's a 2-hour course. I know it's currently being retailed, I think, at 2,800 Rand. But the value of the kit, the items you get in that kit, is over 5,000 Rand, folks. So it's really a really good investment, and really a good educational opportunity for you to be. You can teach yourself how to do these different techniques step by step. So I know the cutoff for this course on June 10th is May the 10th. So I would really encourage you to invest in this program. You know, we've kept the cost to the bare bone because really, you know, the philosophy of our company is teaching better dentistry, and we've always been an education-driven organization. That's why we don't believe in selling me-too products. Everything in our portfolio has a means of differentiation, And I think Dr. Bose has kind of outlined that where he sees the value in Evanesce. And I mean, there's significant benefit to direct resident dentistry versus indirect. I mean, you know, from instant patient-doctor gratification to it being significantly more profitable. I mean, there's no second appointment, there's no lab fees. And with the tremendous improvements and advancements in composite restorative materials, you can really create lifelike restorations where, as Dr. Bose has alluded to, you can't tell where the two structure ends and the restorative material begins. So I think that's about as mean as I'm going to treat you. I know that it's you folks at the end of your day, so really appreciate you supporting this program. And you know, we look forward to working with you and supporting you as you develop your skills. Thank you.
Thanks, Peter. So to our delegates this evening, please look for our follow-up email that will come through tomorrow morning. That will include some product promotions from Clinician's Choice, as well as the registration link for the Dr. Bob Marge's hands-on live session. And then on behalf of Dr. Mark Bose and Peter, as well as the team at Wright Milners, thank you for joining us this evening. My name's Sharon Highton. Good night and have a great evening.
Thank you, everybody.